Good afternoon. And today we have a pleasure of interviewing our guest, Guilleme Fellus from Paris. So I would say good afternoon for us, sort of good evening for you.
It's okay. It's still the afternoon here as well. Thank you very much, Maria, to welcome me in your podcast. I am very glad to be able to speak in front of your audience today.
Yes, and thank you very much to my audience. If you have trouble sleeping or sleep next to snoring partner, this program is going to be for you. We're going to talk about this wonderful device called Froggymouth, what you can use just 15 minutes a day and make your whole airway muscles stronger, what you can sleep better. And if you're a medical professional who, just like us, trying to put all puzzles of this epidemic of our time together, the Froggymouth can be a great tool, great armamentarium to make your toolbox stronger, because you can offer it, as I always talk about form and function, as a function, supporting the form you're trying to create, using orthodontics or oral appliance therapy. And I'm going to talk about a little bit how I met Guilleme. I met not him, but somebody else who worked for Froggymouth on Mewing conference where I was presenting in September 2025. And I really love this idea. I heard about Froggymouth for a long time, and I always dream to introduce my audience with that device. So now we have this wonderful opportunity. Dr. Patrick Fellus, Guilleme's father, developed the device, and he's going to tell us the whole story behind that. And now they want to put that prevention or form and function, what I always talk in my book, Breathless, importance of that. They're going to put it on American market or on a worldwide market, what we can fight as disease of our time. So Guilleme, please tell us, what was the idea behind the Froggymouth?
Of course, thank you very much, first of all, for this wonderful introduction. I'm very glad to speak to your audience. As I said, even more that usually, most of the time, I am spending the first half of my pitch explaining to the audience about the importance of treating dysfunctions. Here, I feel at home, where I only have to explain you why is the Froggymouth so efficient for the myofunctional therapies. So to show you, that's the Froggymouth device. To be able to explain you properly how it is working, I need to explain you how my father was discovering it. And I insist on the word discovering it. It's not something that he was looking for. It's something that he understood at some point. Of course, because he was needing it to throw you back 45 years ago. My father, that is now 76 years old, was one of the first ones to really try to recreate a momentum around the subject of pediatric orthodontics. His master, Professor Defez, Professor Delair, were known to teach all their students how to carefully look after functions and dysfunctions. And because they were stomatologists first, they were teaching them about the importance of always trying to treat as early as possible, because the earliest we treat the patients, the least our efforts needs to be. But when we are speaking about pediatric orthodontics, it's important to say that if we want to get stable results, if we want to have no relapse, we cannot only do the pediatric orthodontic. We also need to get a perfect functional balance at the end of the treatment. Otherwise, we will confirm all the people that said for decades, pediatric orthodontics is not working. Look I made this clinical case study, I made this article, I made this meta-analysis that is showing that actually there is relapse when we do pediatric orthodontics. No, when you are doing pediatric orthodontics with no functional balance at the end of the treatment, yes, there is relapse like in any orthodontic treatment, just even more on young patients because there is more growth to continue. If you are not having the perfect functional balance, you have no chance at all to get a stable results. So for decades, we were throwing pediatric orthodontics in the bin saying it's not useful, it's not working. But some people continued to fight for that, to stand up for that. My father was one of them. I was very lucky to have such a father for that. You can still now type on ChatGPT about the persons that really made in the 70s, in the 80s, help pediatric orthodontic to re-emerge as a field. But for that, as I said, we need a perfect functional balance. So, how do we get the functional balance? For a long time, my father was first using all the typical devices that we were using back then. There are dozens of them. Maybe the most famous one is the Bergensen-Farrell, like my brace-like device, etc. The second option that he started to work on was to only work with therapists. Even more that at the hospital Robert Debré in Paris, there were some therapists that were really involved on all of that. But the problem that he was having with both solutions was the fact that it was requiring such a high level of compliance, of cooperation from the patients to be efficient, and also a tremendous amount of time. Why? Because we were teaching patients how we expected them to do something. So it was taking a little bit of time for them to be able to properly do it when we ask it. But I don't want my patient to be able to do that, to be able to swallow properly, to be able to breathe through the nose. I want them to do that all day long, every day. That's not at all the same thing. That's the difference between engram and automation, which is also something that I have to say we really we were really glad about all the discoveries linked to the neuroscientific field that have been made in the last 20 years. Because we understood at a deeper level what is the clear difference between an engram and automation. But that's not how we discovered the Froggymouth, so to come back on the device. I want to tell you the story of the day when my father discovered the Froggymouth. My father was working with a patient that was having a terrible atypical swallowing, the typical one, tongue thrust, etc. Exactly the one that you imagine right now. And after 2 months working with the speech therapist in France, there was honestly no results at all. He was almost not able to do it on demand, and automation, no chance at all. But at some point, my father needed to take a picture of the dental occlusion of the patients. And so he made the patients sitting down on the dental chair. And because he's very bad with technologics, he took longer to make the setup of the camera, And exactly as you described, during all this time, the patient was wearing the lip splitter, exactly, the lip retractor.
Yes.
And because of the lip retractor, the patients couldn't swallow in primary swallowing. Why? Because primary swallowing require a seal at the level of the lips to be able to swallow thanks to a gap of pressure. If there is no gap of pressure, there is no ability to swallow. So it was exactly creating a full inhibition of the primary swallowing. And so the patient that was waiting for my father to make the setup of the camera was waiting on the chair. At some point of time, he needed to swallow saliva because he was having too much saliva in the mouth. And so what was he doing? Trying to close, but that was not working. So he needed to look for another solution. And what's the other solution that he was at the end finding? Putting the teeth in occlusion and using the peristaltic movement of the tongue to be able to swallow saliva. So at this point of time, my father was saying, "What are you doing? For the last 2 months, I was asking you to do that, and you are never able to do it properly when I ask you to do it. And now I am not asking you for anything. I am just setting up my camera, and you're doing it perfectly, with no results."
Aha moment.
And the patient answered something wonderful at this point of time. "I don't understand what you are saying, doctor. I am not doing anything different than usual." That was the eureka moment for my father, as we say. He realized that instead of only trying to explain the patient with words what we expect him to do with muscle movements, we could also use something that is so human because we are animals shaped by millions of years of evolution: the adaptation ability of our brain. When we are facing a challenge, an obstacle, we need to adapt and overcome. That's what we are made for. We are the descendants of the people that were able to adapt and overcome. So we are able to do it. And that's exactly what is happening when you are wearing the froggy mouth. You wear it like that between the lips, and only between the lips. Do not put the teeth inside. Like that.
Mm-hmm. That look nice, sexy.
If you've seen, I was just swallowing my saliva right now. Even if I am in primary swallowing, I cannot do it thanks to a gap of pressure. So I have to adapt. We are teaching the same stuff, but from the back door. We are not explaining what needs to be done. We are forbidding, inhibiting, making impossible what is wrong. And we say to patients, "Now, what are you doing?"
This is fantastic. I want to ask a tricky question. How my audience can order the froggy mouth to use it 15 minutes a day to develop correct swallowing?
Of course. So first of all, we are very glad to be able to enter recently the American markets. You mentioned at the beginning of the podcast our dear common friend Samantha Weaver. That's first of all, I have to say, with Mark Muller, did an absolutely tremendous job for developing myofunctional sciences. I think that now it's becoming more trendy and there's more and more people speaking about myofunctional sciences in general. But let's always remind that 10 years ago, there were only a few people that were doing that. And it's thanks to the work of those few people that we are there nowadays, with more and more people wanting to know more about functions. So Samantha and Mark are really one of them pushing my functional sciences for the last decade. And I am very glad to work with them for a long time. We are also developing a great distribution network in America, but in all the countries in the world, because I know that you also have audience and viewers from absolutely everywhere. So
Yep.
the best stuff I can say to anyone that is listening to us right now is to type the country that you are on and Froggymouth, and you will directly be redirected to the websites, either of Froggymouth.com, where you can just send us a message and we'll directly put you in contact with your local distributors, or directly finding out the website of the local distributors, because we were lucky enough with the Froggymouth team to catch the interest of a wonderful French entrepreneur that is called Philippe Véran, that wanted to develop a politic of preventions for myofunctional disorders, and that is, first of all, the CEO of Biotech Dental, a beautiful French company, but also the president of Henry Schein Orthodontics, an American company. So that's why we are an American company that is almost in every country in the world. So that's why we are very happy that now we are going to be distributed and available in almost any countries that you can imagine. So just contact
That's
us.
fantastic. So for my listeners, to give the short version, you have to go on a website, Froggymouth.com, and we're going to put the information underneath this interview, and
Exactly.
find your distributor. And that's how you can get to the passive myofunctional therapy, using it 15 minutes a day. But I want to ask you, because this my audience really united by the problem with sleep. We want to help people to sleep better. We want to develop the muscles, but to prevent collapse, breathe better during the day. So how Froggymouth, what's correct swallowing, what's wrong swallowing, and how it's related to bad sleep?
I think that's it's not the direct link, but the two-step links that needs to be dig into. Once again, I am going to quote Mark Muller and Samantha Weaver, that did a wonderful job for my functional sciences. And I think that 8 years ago, they introduced me to another French person that I was meeting through my American friends, but it was absolutely wonderful to meet this person, because it's Christian Guillemeau that was having the impact that we all know about sleep apnea. He really did so much for that. And the last part of his life, I think, was really dedicated to the fact of not only describing this pathology, but also trying to look for a solution to prevent it as much as we can. And he was clearly stating that having a myofunctional balance is one of the most important stuff that we made you to avoid that. It will be a lie to pretend that it only links to myofunctional disorders, because there's other criterion like the age, the weight, the gender. We know that male are more touched by sleep disorders than female, but when we are removing all of that, we are still absolutely sure of one thing. You want to be impactful on avoiding any kind of sleep disorders. Breathe through the nose. People that are listening to us are not knowing what we discussed before, but I think that it's a good point of time to also bring it, because it's not a knowledge that we just discovered. Right before, we were speaking about an author that we both love to quote, that is named George Catlin. And that was an American citizen, an American lawyer that decided to throw away his career to look after his passion, becoming a painter. And for that, he decided to go live into some Native Americans villages. And he was so shocked to notice all the differences that they were having in terms of not only, but also sleep quality, shape of the face. And he was noticing that in one generation, when the Native Americans were changing for the Occidental habits, they get all the same problems than we had, which was a clear evidence that we were not speaking about a genetic problem, but a question of habits. And
Environmental.
he was writing exactly in 1867, if I am not mistaken, so more than 150 years ago. What is one of the first book linked to my functional therapy, Shut Your Mouth and Save Your Life, because he was noticing this big difference. All the Native Americans, when they were sleeping, they were having the mouth closed, they were breathing through the nose. And because they were breathing through the nose, they were able to downgrade a little bit the temperature of their brain, which was helping them to go into the deep sleep. That's what we discovered later, but he was already 150 years ago noticing that that was the key point. How are you breathing? And it's not a mystery. We are made to breathe through the nose.
But I would like to interrupt you, Guillaume, because I remember this beautiful movie you're trying to bring on the screen. Maybe you can show us in a schematic form how Froggymouth work inside, what people have urgency to buy it. I'm going to bring your slide on the stage and you explain how it works.
Of course, what I want to say regarding this slide is the fact that some people, for long amounts of time, when you are saying the Froggymouth device right here, are saying, what is this device? I know we should not breathe through the mouth, and
mouth is
you
open.
are keeping the mouth open. So you have a very bad device because you were probably not realizing, but it is not preventing the mouth breathing. Ah, yes, I was not thinking about that. No, because once again, what I am trying to do with the Froggymouth is not to teach a patient to do something, is to have this patient automating the new pattern. What I actually want is not my patient to breathe through the nose when I ask for it, but to always do it. So that's why I cannot count on closing the lips to avoid the mouth breathing. Why? If I count only on closing the lips to avoid the mouth breathing, it means that when I open the lips, I go back to mouth breathing. And during the day, we have a lot of occasion to open the lips. To speak, to eat, to drink, to kiss your girlfriends, whatever you want. What we need to do is wondering what are doing all the patients, all the humans that do not need any therapy and that are just naturally breathing through the nose. Are they not breathing through the mouth because they get the lip open, or are they having another seal to avoid the mouth breathing? Yes, they do. Froggymouth, as we said, is going to teach you how to change your swallowing pattern. That means that before you were having this swallowing pattern with a low tongue posture, and we are going to teach you that to swallow with the Froggymouth, you cannot swallow things to a gap of pressure. You have to swallow things to the peristaltic movement of the tongue, as you were just seeing. And then you are having this high posture of the tongue, and not only of the tip of the tongue, because if you are only focusing on the tip of the tongue, then you are getting a wave shape of the tongue. And the bottom part, the most important one, is low. What's matter is to get the bottom part high. And if you get the bottom part, the back parts high, the front part, the tip, is also high as a consequence. And when you are having this tongue like that, what happens when you breathe? You cannot breathe through the mouth. So you are directly breathing through the nose. And that's how a device like the Froggymouth is actually maintaining lips open, but actually avoiding mouth breathing on the long term, and not only when lips are closed. That's how we are so efficient at treating the mouth breathing. And if you just need to be convinced, I sorry for little interruption. So what's really matter for us is to be able to show our patients and show also to all of you that what we are saying about the posture of the back part of the tongue is so important. I invite all of you to do a simple test. Try first to only focus on the tip of the tongue. And you're putting the tip of the tongue right there. If you want to breathe through the mouth, directly it's working. Now, do something else. Now, do not think at all about the tip of the tongue and raise the styloglossus, the back part of your tongue, stuck to the palate. And you are seeing that at the moment when you are doing that, you are directly breathing through the nose. Why? Because our brain is perfectly getting the message. High styloglossus, I breathe through the nose. That's how this device maintains lips open and is super efficient to treat mouth breathing.
Fantastic. Thank you very much, Guillaume. We really appreciate you sharing wonders about this device. And we're going to put information underneath the interview where people can find a way to buy it in United States and in any country. So thank you very much for that. And I'm going to mention, I put the myofunctional ideas in mouth breathing and nose breathing in my book. And this is the additional way how to make you breathe through the nose, make your tongue stronger, and sleep better. So thank you very much.
Thank you so much.